1. Postpartum mental health, a pharmacist's guide to supporting new mothers. 2. Maternal mental health, why we need better central policy. Dr. Geetha Desai. 3. Overcoming postnatal depression, Rachelle's journey. 4. Breaking the silence, my postpartum depression journey and why you should seek help. 1. Postpartum mental health, a pharmacist's guide to supporting new mothers. Imagine navigating the complex journey of motherhood, where every step in the postpartum period brings its own set of challenges and emotional swings. This is a critical time that can shape a mother's health for years to come. But here's where it gets controversial. Despite its importance, postpartum care often receives less attention than other aspects of maternal health. In the podcast Scripted for Her, hosted by Natalie DiPietro Mager, PharmD, PhD, from Ohio Northern University, these pressing issues are brought to the forefront, offering invaluable insights for healthcare professionals, especially pharmacists. The podcast serves as a vital resource, aiming to enhance the continuity and comprehensiveness of care that pharmacists can provide to their patients. Each episode delves into crucial topics within women's and maternal health, equipping pharmacists with practical advice to positively affect patient outcomes. And this is the part most people miss: pharmacists are positioned uniquely to support new mothers during this transformative period, where physical, emotional, and social changes are profound. Postpartum health extends from childbirth up to a year, and involves significant transitions that can impact a woman's long-term well-being. Alarmingly, 1 in 5 women experience mood disorders during this time, ranging from the common baby blues to severe conditions like postpartum depression and psychosis. The stakes are high, as untreated mental health issues can have long-lasting effects on both the mother and child. Thankfully, resources such as Postpartum Support International and National Maternal Mental Health Hotlines provide essential support. These resources offer information and connect women to local services, crucially bridging the gap in healthcare access, especially in underserved areas. The conversation between Natalie DiPietro Mager and Lindsay Ferraro, PharmD, sheds light on the multifaceted nature of postpartum care. They discuss the role of pharmacists in recognizing and addressing postpartum mental health disorders and explore emerging treatment options that are reshaping how care is delivered. Tune in monthly to Scripted for Her on drug topics to catch these critical conversations that could revolutionize the care you provide at all life stages. With episodes available in both video and audio formats, this is a resource you don't want to miss. Ready to impress your colleagues with the latest updates in drug information and patient care strategies? Subscribe to the free Drug Topics newsletter today. What do you think about the role of pharmacists in supporting maternal mental health? Could this be the key to better postpartum care? Share your thoughts and join the conversation below. 2. Maternal mental health, why we need better central policy. Dr. Geetha Desai. We urgently need a more effective national policy regarding maternal mental health, asserts Dr. Geetha Desai, a distinguished professor in the psychiatry department at the National Institute of Mental Health and Neurosciences, NIMHANS, in Bengaluru. In a country where mental health awareness remains relatively low, how can families identify when someone is experiencing postpartum depression? There has certainly been a rise in awareness, particularly in urban areas, largely due to the influence of social media. However, many individuals tend to normalize the emotional and psychological changes that occur after childbirth. So, what should families look for in a new mother? Signs include frequent irritability, excessive crying, heightened distress, difficulty sleeping, disengagement from social interactions, withdrawal from others, and a lack of involvement in childcare. These behaviors are all red flags. Additionally, new mothers may experience significant anxiety, which can often accompany depression. For instance, they might become overly concerned about their baby's well-being or find themselves plagued by negative thoughts such as, "I'm not a good mother." You may notice them constantly seeking reassurance from family members about their parenting choices. They might also engage in negative self-talk, or be excessively critical of their parenting skills. These indicators suggest that the mother may be experiencing a depressive episode. Do you believe that self-criticism is exacerbated by societal expectations that women should naturally be caregivers and nurturers? Absolutely. The societal pressure to conform to the image of an ideal mother significantly contributes to this self-criticism. This is where the normalization of feelings like sadness and overwhelm becomes problematic. When we dismiss these feelings by saying, "Oh, it's just part of being a mother," we risk overlooking those who genuinely need assistance. First-time mothers, in particular, require our support. It's crucial to openly discuss and challenge these societal norms surrounding ideal motherhood in public forums. Equally important is how these expectations are internalized by the mother herself. This must complicate the bonding process with the baby. What impact does this have on the child? Research has provided ample evidence that maternal depression can hinder the bonding process between mother and infant. It can also interfere with breastfeeding. The severity and duration of the mother's depression play a significant role in determining the extent of this impact. Challenges in the mother-infant relationship can adversely affect the child's emotional and cognitive development. Studies have shown that maternal depression can lead to emotional difficulties in infants and may increase the likelihood of mental health issues as the child matures. However, it's essential to note that while postpartum depression receives a lot of attention, many women actually begin to experience depressive symptoms during pregnancy. This is why it's more accurate to refer to it as perinatal depression, encompassing both the pregnancy and postpartum periods. How would you assess the current levels of awareness among the general public and medical professionals? There have been community campaigns aimed at raising awareness about postpartum depression. We are actively working to enhance understanding of perinatal mental health issues through various initiatives, including radio programs. Among obstetricians and gynecologists, I've observed a growing interest in recent years. They are increasingly willing to engage in discussions about this topic, and are inquiring about how to screen women for depression. We have been conducting workshops and presentations at medical conferences. While we are making progress, there is still much work to be done. What practical advice would you offer to family members who wish to provide support? First and foremost, it's vital to be open and willing to listen to what the mother is experiencing. Avoid normalizing her feelings or being overly critical. Sometimes, simply listening to her can be incredibly helpful. Secondly, offer practical support. This includes physical assistance, such as caring for the baby, allowing the mother time to rest, ensuring she has proper nutrition, and discussing her concerns. Encourage her to seek help for postpartum depression without stigmatizing her mental health struggles. Too often, families label these mothers as mentally unwell, and it's crucial to reduce that stigma. Is there a genetic component to postpartum depression? While genetics can play a role, it is not the sole risk factor. Genetic predisposition may increase the likelihood of developing depression, but there are also protective factors to consider. Not everyone with genetic risk factors will experience depression. It's essential to screen mothers who have multiple risk factors, such as those facing domestic violence, lacking adequate support, experiencing complicated pregnancies, or having a history of depression. Early screening during pregnancy can help identify signs of depression sooner, allowing mothers to receive timely assistance. In an overburdened public healthcare system, how feasible is it to identify these cases? Some states are making strides through task-sharing approaches. Healthcare workers conduct initial screenings, and if they identify women at risk or experiencing depression, medical officers or obstetricians perform a more in-depth assessment. We are also training obstetricians on when to refer patients to psychiatrists or mental health professionals. This step care approach is being implemented in various states and districts. However, we still require a more comprehensive national policy on maternal mental health. When should someone seek professional help? While the general guideline suggests seeking help if symptoms persist for 2 weeks, it's crucial to act immediately if someone expresses suicidal thoughts or behaviors. It's always better to seek help sooner rather than later. The longer a mother remains depressed, the more prolonged her recovery will be, and the consequences can be significantly worse if treatment is delayed. Early intervention is key. Who should be the first point of contact for assistance? This could be a general physician, an obstetrician, or a mental health professional. Awareness of maternal depression should be widespread. Everyone should know how to assist and where to direct mothers seeking help. For pregnant women, obstetricians are often the best first point of contact since they see these patients regularly. Many obstetricians are equipped to provide initial treatment for depression. Q. Can postpartum depression become a chronic condition? Only a small percentage of women develop chronic depression. Many women experience improvement with appropriate treatment. 3. Overcoming postnatal depression, Rachelle's journey. The profound shift into motherhood can sometimes mean losing sight of yourself, and it's a reality far more common than we often acknowledge. Rachelle, a woman from Bristol, bravely shares her experience with postnatal depression, a journey that began with a difficult birth and was compounded by subsequent heartbreak. Her story isn't just about overcoming illness, it's about rediscovering identity after life-altering change. Rachelle's daughter, Willow, arrived 4 years ago after a challenging birth where she experienced periods of unconsciousness. This traumatic start was followed by the painful experience of multiple miscarriages, leaving her feeling profoundly isolated and descending into what she describes as a very dark place. She explains the overwhelming feeling of disconnect. The first couple of months were really, really hard. I felt like I'd lost who I was. Growing up in a large, close-knit family in the Philippines, Rachelle always envisioned a bustling household filled with children. However, the reality after Willow's birth, a healthy 11-pounds baby girl, was unexpectedly lonely. She found herself consumed by a sense of depression and a surprising anger. All my habits, all my hobbies, all the things that I used to do, I lost because my entire life revolved around this tiny little being that depended on me, she explains. This is a sentiment many new mothers can relate to, the complete reprioritization of life, and the quiet struggle to maintain a sense of self amid it all. But here's where it gets controversial. Society often pressures new mothers to appear perpetually joyful and capable, making it incredibly difficult to admit when things are truly difficult. She describes the common tendency to put on a brave face, saying, "We grin and bear it and say we're fine, everything's fine," but really it's, "No, we're sleep deprived, no, it's getting to me." This highlights the pervasive culture of silence surrounding the challenges of early motherhood. Postnatal depression, PND, is surprisingly prevalent, affecting over 1 in 10 women within the first year after childbirth, according to the NHS. Symptoms can manifest as persistent sadness, debilitating fatigue, a loss of interest in activities once enjoyed, sleep disturbances, and a tendency to withdraw from social connections. It's crucial to seek support if you suspect you might be experiencing PND. Early intervention is key. While the exact causes of PND aren't fully understood, a healthy lifestyle, and crucially, a strong support network are considered protective factors. And this is the part most people miss. Support isn't just about practical help with childcare, it's about having someone to confide in, someone who understands the emotional turmoil without judgment. After Willow turned 2, Rachelle and her husband began trying for another child, but faced 2 years of heartbreak and multiple miscarriages, ultimately deciding to pause their efforts. "There are days when I've had to drag myself out of bed," she shares, describing the immense grief she carried in silence. "You experience so much grief, but I kept it all to myself. No one knew apart from my husband." She points to the societal pressures and internalized shame that often prevent women from openly discussing these experiences. Women don't talk about these things out loud, maybe because it's hard to talk about. Guilt and shame plays a lot into it. 4 years later, Rachelle acknowledges she's still on a journey of self-discovery, working towards reclaiming her identity. However, joining baby and mum sessions when Willow was young proved to be a turning point. She found a mum tribe, a community of women who understood her struggles and offered invaluable support. "It was nice to find other people who related, who I could text at 3 in the morning going, 'I'm having the worst night ever,'" she recalls. Driven by her positive experience, Rachelle has now launched her own children's activity franchise, serving North Somerset and Southwest Bristol. She emphasizes the importance of these activities not just for children's physical development but also for mothers' well-being. Just as much as it is for babies to move their little bodies, it makes such a difference for women to make new friends and find that womanly support. Rachelle's story is a powerful reminder that motherhood, while beautiful, is also incredibly challenging. It's a call for greater openness, empathy, and support for new mothers. Do you agree that societal expectations place undue pressure on new mothers to appear perpetually okay? Or do you believe individuals should prioritize maintaining a positive outlook regardless of internal struggles? Share your thoughts in the comments below. Perhaps we need to reevaluate our understanding of good motherhood and embrace the vulnerability that comes with such a transformative experience. 4. Breaking the silence, my postpartum depression journey and why you should seek help. Postpartum depression can feel like a silent avalanche, crashing down just when a new parent expects to be at their happiest, and it often strikes without warning. Katie Harper knows this feeling all too well. After welcoming her daughter Charlotte into the world, Katie suddenly found herself unable to get out of bed, losing her appetite, and crying constantly. Instead of dismissing these symptoms as ordinary baby blues, she turned to the one professional she trusted most, her obstetrician-gynecologist. This decision changed everything. Katie's strong relationship with her OB/GYN helped her recognize the early warning signs of postpartum depression, a step many parents struggle to take. At first, I didn't want to admit what was happening, she recalls. But once I opened up, my doctor was ready with real solutions. But here's where it gets controversial. Too many families still treat postpartum depression as an unavoidable rite of passage, or worse, a weakness. According to Dr. Kristen Coppage, a maternal-fetal medicine specialist at Ohio's Tri-Health Fitness and Health Pavilion, mental well-being deserves the same level of care as physical health, before, during, and after pregnancy. She points out that women's health providers can run lab work to rule out medical issues, prescribe medication when appropriate, and connect patients to counselors or support groups. And this is the part most people miss. Your routine prenatal or postpartum appointment can double as a mental health check-in. You don't have to wait for a separate therapy session if you're already scheduled to see your OB/GYN. That single conversation, Dr. Coppage emphasizes, can be the gateway to life-saving resources. Katie's journey highlights another critical message: postpartum depression is common, but it doesn't have to be accepted as normal. Seeking help early allowed her to stay with the same provider for ongoing mental health care, making her recovery smoother and less intimidating. She now encourages other parents to speak up and ask direct questions, whether about medication, therapy options, or lifestyle changes that might help. Still worried about where to begin? The National 988 helpline is just 3 digits away and can instantly connect you to local mental health providers. You can also schedule an appointment with any healthcare professional you trust, family doctor, midwife, or mental health specialist, to start the conversation. Big takeaway: pregnancy and childbirth transform more than just the body. They challenge the mind and emotions as well. Acknowledging that fact and acting on it can prevent months of silent suffering. Question time. 1. Should routine postpartum appointments automatically include a mental health screening, just like blood pressure checks? Why or why not? 2. Do you think society still underestimates postpartum depression, or have we finally begun treating it as the serious medical condition it is? 3. If you've experienced or witnessed postpartum depression, what resources or strategies made the biggest difference? Add your insights and let's spark a respectful debate. Your experiences, agreements, or disagreements could help someone else decide to reach out for support today.